Okay. Good morning, everyone, and welcome to our Careers in Nursing panel. I'm Dr. Shauna Clark. I'm with the Office of Intramural Training and Education, and I will be moderating our session today. Um, we have Sandra Cooper Bennett with us, who is a clinical research nurse too here at the NIH Clinical Center. And we also have Lenora Holloway, who is a nursing consultant in the Clinical Center Nursing Department in the Office of Recruitment Outreach and Workforce Management. And hopefully in a moment, we'll also have Sophia Francis, who is a nurse at Holy Cross Hospital and who is also an alum of Community College Summer Enrichment Program. So welcome. And what I'd like to do first is just have you both introduce yourselves and tell us a little about yourselves. We'll start with you, Sandra.
Hello. How is everybody doing? My name is Sandra Cooper Bennett, and I'm a clinical research nurse at the NIH in Building 10. I'm currently the clinical educator on the special care studies unit. I've also worked on 3 Northwest, which is a medical oncology unit as a clinical educator for the past a number of years. I've been at the NIH for 15 years. I started working at NIH actually through an application that I make through this program. Unfortunately, fortunately, nursing saw my resume and they kind of gobbled me up. Otherwise, I would have been in your CoSTEP program. I worked at NIH while I was a tech in nursing school, and then I graduated and worked on 3 Northwest as an oncology nurse. We do a lot of clinical research studies, investigating new drugs, new medications. Currently, I'm on the special care unit where we're dealing with a lot of COVID patients and a lot of COVID protocols currently at the moment. So I do a lot of training in terms of PPE, personal protective equipment, and just other things with the staff and also other members of the multidisciplinary team.
Oh, wow. Sounds like you are super busy. Thank you so much for being here.
You are so welcome.
Lenora, can you tell us a little bit about yourself? Thank you.
Hi, good morning, everyone. My name is Lenora Holloway. I'm a nurse consultant for the Recruitment Outreach and Workforce Management, which means I have the wonderful job of being the nurse recruiter for the Clinical Center Nursing Department. So I have usually the opportunity to be the first face that you meet if you are initiating or putting in an application for a career with NIH Clinical Center. I've been with the NIH for about 6 years. I was a transfer from the Department of Defense, and I've also been a operating room nurse that worked in many other hospitals within the community, such as MedStar Georgetown, MedStar Washington Hospital Center, some freestanding surgery centers. And I'm delighted to do this. I do this every year. This is a little different virtually because I normally like to see everyone's face and kind of connect with you, but feel free to ask us questions. We enjoy this. Sandra and I work together, and we're just excited to have this, especially during this time in nursing when we're dealing with an historic healthcare events that we probably hope to never see again.
Yes. Thank you
for
so
joining.
much. Yeah. So that's exactly how this is going to work. We're going to open questions to the audience, and I have a few questions of my own, of course. So please feel free to type your questions in the Q&A section, and we will read your questions out loud to the panelists. We already have one from Ella. Ella's asking, is it possible to get a job with the NIH as a nursing student?
So the Clinical Center Nursing Department does not have like a sponsored student nursing program. However, if you are a medical support assistant or a patient care coordinator, or you have some other kind of type of background in healthcare, you're definitely welcome to apply to those type of vacancy announcements that we have, but not a specific nursing department kind of student program.
Okay, thank you. So the next question is, what is your day like with COVID-19 and what was it like before?
Sandra, you take the lead on that one. You're in the trenches.
Yeah, I was going to say.
Well, it was very interesting actually when it all started. I mean, it took an all hands on deck effort to get everyone trained. The clinical center, well, most people, we have the PHS, the Public Health Service system that works within the NIH, and they're like pharmacists, nurses, doctors, and so forth. So my department took the lead on trying to train everyone in terms of the gears, the precautions that we should use, and so forth with COVID. So I remember coming into work one morning and the entire unit was changed. I mean, my boss met us at the elevator and everything was converted to negative pressure, negative airflow, in order to facilitate what we thought we were going to get. I don't know if you remember those passengers that were on the cruise ship. At first, they thought that we were going to get all those passengers that, I don't know if you guys remember, they were like caught out in sea when COVID came. So we started out by converting the entire unit and then training for the staff and other members of the NIH. So it was kind of chaotic. I mean, at that point, we didn't have a finger, you know, on the pulse of what was going on. So of course, there was a high level of anxiety, not knowing what to expect, not knowing what was going to happen. So of course, it was a huge learning curve for everyone, including myself, in terms of training and learning about this disease and the precautions and taking care of our first COVID patient, which it was a joint effort between us and the ICU when we just started. So it was a all hands on deck. So it was very interesting, crazy, very enlightening. Fearful, of course, but with the good, we had a good support team in terms of the NIH leadership. So whatever we needed, we had. For example, there were hospitals on the outside that didn't have proper PPE. People didn't have masks. Nurses were out there in the trenches. But thank God for NIH, we had what we needed in terms of personal protective equipment. We had masks, we had the gowns that we wear, we had PAPRs, which are the helmet that we use. So I felt very confident in terms of being at the bedside or being at the NIH, because I felt like what we needed, we had.
Right. And that sounds very high stress and very high adrenaline. How does that compare to your normal day, pre-COVID?
Oh, there's no comparison. I mean, to be honest, I mean, there's no comparison because COVID came. So that means that I'm a hugger. And, you know, you greet people, you want to hug them, you see your coworkers that you haven't seen. I mean, for a long time, we were taught, you know, be careful, you know, you couldn't touch, you have to be meticulously always cleaning your work area where you sit. You can't see the faces of your colleague. And then when this happened, a lot of staff went on telework. So there's a lot of people that I haven't seen Lenora in such a long time. How long I haven't seen Lenora. So there were so many people that as a result of COVID, we haven't seen. And then they basically kind of shuttered the clinical center. So we kept the patients that we already had because of whatever was going on with them. You know, they're immunocompromised. We didn't want them going back and forth. Some of them were on treatment, so we couldn't really send them home, considering that the entire country came to a standstill. So, I mean, coping, for me, I can tell you what I did was I hit the outdoors. So I went to the park. I started to do African dances online. Like I found a couple on YouTube. So I would try to do that every day to keep myself mentally stimulated. I mean, we had a lot of stuff that, you know, when you're at work, you don't get the time to get caught up on, like your resume, doing your annual competencies, online trainings that we have to do. So there was a lot of things to keep you distracted, but at the same time, at the back of your mind, that there was this pandemic when nobody knew what was going to happen. I mean, I couldn't see my family, you know, because I was scared. I worked in the hospital. So of course you're exercising caution. You don't want to, you know, kind of endanger them, you know, taking care of COVID patients and then going back and forth to see my mom. So, I mean, without a doubt, it was a very stressful time, even now not knowing what's going to happen, but at least we see a little bit of light at the end of the tunnel. We now have a standard treatment for COVID patients, which I must say that came out of the NIH. Some parts of it came out of the NIH. So now we know we have what we need for standard of care. So, you know, that's a good feeling to know that you were part of the process and to see that you're actually helping patients and they're actually walking out of the hospital. You know, so there's a thin line. At least now you have a balance. There's a little bit of light, and then there's this uncertainty, not knowing what's going to happen. Seeing the spike in COVID.
Right.
So it's about balance, and it's about getting outdoors, meditation, doing my little African dances, doing my yoga. I don't get to actually go into the studio, but it's all of those combined that keep me afloat. Yeah.
Wow, you've mentioned some really great ideas about how to keep well in stressful situations. So thank you so much for that.
Yes, and if I might add, the
Sure.
NIH is such an awesome place because they have all these resources. Lenora, you can speak to a little bit of that. I mean, we have a CEO and they send out weekly emails about getting help. Getting help is a sign of strength. You know, you always say that because sometimes people think that, oh my God, if I see someone, that's a sign of weakness. You know, and that could be a cultural perspective. So we have all these resources that they encourage us to really tap into. I mean, there were mornings that they had yoga online when a lot of people were teleworking. So they have all these resources to help you. So I must say that the NIH play a part in that as well.
So I think that's a great segue actually into the next question from Jennifer. She wants to know, what is some advice you can give to aspiring nursing students? And I think one thing that you've already made very clear is that you have to take care of yourself. In order to take care of others, you have to take care of yourself. So what's some other advice that you, either of you, could give to aspiring nursing students?
So one thing I can say about aspiring nursing student, I remember going to school and I went to Howard University, and I never forget those professors would always tell us, you must maintain a balance. You must have a life outside of nursing. I'll never forget that. You know, if you're into the arts, if you're into, you know, whatever you're into, there must be a balance, because if not, you have to be able to replenish yourself, as you're not going to be able to give to others. And as a nursing student, once you have the passion, right? You have to have the passion for nursing itself. So that's going to be your drive because you have the passion. But at the same time, you have to be able to maintain that fine balance where you're going to be able to take care of yourself in order to receive and give back. Receive what you're learning in school at the moment and to be able to give back. And I know that as nursing students, we're stretching so many directions. You know, we have family to take care of, we have these jobs, we have to maintain those grades in order to advance to a different level in nursing and to actually graduate. So it's very important to have that mindfulness, like show yourself some love. And that's something that I'm learning as I go along. And I tell myself, okay, I'm going to show myself some love. And showing yourself some love could mean that, oh, I'm going to take 15 minutes out just for myself, maybe to just sit outside in the sun if you can afford to do that. But it's just about showing yourself some love and maintaining that balance. That's just my perspective.
If I could add, because I know many of you are in the student role, and so being a student and trying to launch your career right now must seem more difficult than ever. There's so much uncertainty. What I'd like to talk to you about is resilience, and piggyback a little bit on what Sandra said. Kind of be prepared to have resilience. Things don't look quite the same. Typically, if it was like go backwards to 2019, you guys would be in a room. I'd be handing out cards. We'd be taking selfies. I'd be telling you all to come, scheduled to come in and take a visit and tour the NIH. I'd have a little bit better, a little bit more warm and fuzzy to go along with this scary thing called a job search. But I like to tell you right now, just have a little resilience as you're going through. COVID has impacted so many areas where healthcare and healthcare professionals are needed. So say, for example, and I apologize for that because I was supposed to silence that. Say, for example, if you were to have your eyes set on a particular hospital and they're not hiring or they're not able to give you some training opportunities, don't give up. Look at other training. Long-term care areas have been totally impacted by this disease in the worst way. So just don't give up, have resilience, and bear with the healthcare leaders, because we're learning on the way too. And everything may not work out exactly as you had planned prior to 2019.
Right. And we actually have a question that goes right along with that idea of being resilient. So this question says, unfortunately, some students don't get accepted into nursing schools, but finished all the prereqs. What do you suggest they do while they wait to apply again?
Can I take that? I would love
Yes.
to take that. So I want to share my story and piggyback on resilience, as Lenora said, because when I went back to school, I was an adult learner. I had a family. I had to work. And when I did my prereqs, I remember the first year when I did my med-surg, I did not meet the grade to advance into the next phase of my nursing. And I was devastated. I started to doubt myself. Oh my God, was it meant for me to be a nurse? I was devastated, totally devastated, because I felt like it was hopeless. But what I did was, at Howard, we had this program where you could get a bachelor's in healthcare management. And most of the prereqs were closely aligned to some of the prereqs that we did in nursing. So what I did was I had to wait 1 year before I could get back into the nursing program. So while I waited, what I did was I did classes in that health management course. And I actually graduated 1 year with a degree in healthcare management, and another year, the next year I graduated in nursing. So don't be discouraged. As Lenora said, be resilient. Don't just sit out and feel hopeless. I mean, take prereqs. You might want to take a second language. You might do some art, some fine art. You might look around and see what other curriculum that aligns closely with nursing that you might want to, you could end up having a double major like I did. I mean, that wasn't the intent, but I turned that negative into a positive. So there's always a way out. When you see a wall, there's always a door behind that wall. So look into what those other programs are, and you might end up graduating with 2 degrees.
Oh, that's great. Thank you. So I have a bit of a change in questioning here. Does the NIH hire associate degree nurses or only BSN completers?
Hi, yes, we have a residency program. We do accept an associate degree for the nursing department. The ideal candidate will have a BSN. Now with that, you have to have a bachelor's degree in another area. So OPM, the Office of Personnel Management, who governs what we do, requires that you have some form of a bachelor's degree. So we would accept if you had a bachelor's degree in another career field and an associate degree in nursing, you would be eligible to apply for the program.
Okay, thank you. And I'd actually like to take a step back. And Sandra, thank you for sharing your personal story. And it sounds like you had to have passion for nursing to keep going in the way that you did. Can you both tell me what prompted you to become nurses?
So interestingly, I've asked myself that question all the time. What made me go into nursing? Because of my love, honestly. It was like, from a very young age, I've always known that I wanted to be a nurse. It could be watching my mom growing up in the islands, just always helping people. Like she would always be going, helping neighbors. If this person needed help, she would be there helping that person. If this person needed taken care of, she would do that. I don't know where that desire came from, but I know that from a very young age, that was my passion. And I had my children when I was young, so for a while I deferred my what would you say, my quest to be a nurse, to be a mother, because I was a single mom. And I had good jobs, but for some reason, that urge and that little voice in my head would not let me give up that journey, my journey to be a nurse. And I can tell you this, it took me 25 years to the date that I migrated to the United States from Jamaica to graduate with my nursing degree. 25 years. And what I did was I would take classes here, something would happen, I would stop. I would take classes here, something would happen, I would stop, but I never gave up. So back to resilience, like Lenora talked about. I work in banking and I had good jobs. I work in banking. I worked with Metro as a customer service agent. Good job with good benefit, but guess what? That urge, that passion, that desire to help others in a different way, because every job I feel like you're giving back, but that desire, it just would not let me quit for whatever position I was in. So I've always, and then at one point my dad got sick and he died. And then I said, okay, this is it. I'm going to give it my 100%. So what I did was I stepped out on faith and I quit my job. Came to NIH. I worked there part-time as a tech. And guess what? Through all the struggles, I did it because of my passion, this innate belief that I was here to serve people in a nursing capacity, right? I knew that my role is to serve, to help that person. And then it led into the education role, where my desire for helping people and sharing all the great things that I've learned at NIH, I wanted to give back. So another way to give back was to get my master's degree and to go into education. And Lenora and I kind of work in synergy with each other, because they bring in the nurse residents fresh out of nursing school, and then we would get them on my unit. And then it's like watching this creation. It's like you're pouring everything that you have learned into this vessel, right?
Wow.
You're pouring them, you're navigating, you're helping them to navigate the system, which is equally as satisfying as being there at the bedside, holding somebody's hand or administering medication or watching them cry or doing something. So that was always my thought. I feel like I was just born to be a nurse.
Wow.
I don't know if that makes any sense.
Actually, just listening to you and the passion in your voice about nursing and teaching really gave me goosebumps. I mean, it's really exciting to hear someone so passionate about the work that they do. So thank you for that. Lenora, did you want to add to that?
I do. First, I'd like to say Sandra is the mother of the nurse resident that she gets. She's truly the mother. So if anyone that she becomes a mentor, preceptor, or educator, they are really under her wing. And she really does a great job at taking care of that nurse and nurturing them while they're in the process of learning. My career path was totally different. I stumbled into nursing. I ended up, initially wanting to do something with food service and nutrition care. And I worked at GW in food services. I delivered trays and worked at a long-term care facility and delivered trays. And then I slowly, because of family situations, had to stand up, adult up, become an advocate for my father, who was sick and could not advocate for himself. I took that advocate role, and it led me into nursing. And that's the beauty of this profession. I started out, I've worked in many different environments with many different types of people, but I can tell you something, this is the most diverse profession right now. And even throughout COVID, there are so many possibilities. So you're not just in a corner. You're not in a box in nursing. You can be, I'm a consultant recruiter now, totally different. So I had to learn human resources and healthcare management. I did the back end. I had to get a degree in healthcare management in my my graduate studies to kind of be able to do this now. So untraditional, it doesn't matter which way you go in there, but just as long as you go, but the resilience is key, because you can easily get pushed out. It's really critical.
So now that we know what prompted you both to be nurses, is this career what you envisioned? And if there was one thing you could change about your job, what would it be?
It's more than I envisioned, because I never actually thought that I would be on this side. I remember wearing my recruiter when I was on the floor. I wanted a new job like every year. I needed to try something else. I knew I was going to have this job because I just literally stayed in my recruiter's office like every year. And I had to find myself what I was looking for, but that's what I was saying. I mean, pediatrics, now there's legal nursing, nurse consultants, there's military nursing. There are so many avenues until you're almost you will find what you like. Behavioral health, psychiatric, now addictions, those are things that we offer there. So there's so many areas where nurses fit in. And as you can see with everything that's going on, we're really probably going to integrate with law enforcement probably soon. I'm sure policies are written now, because as we've looked at 2019, we see a lot of those areas where there have been arrests, but there's almost needed to be like a mental health professional or a registered nurse there to help to intervene in that. So I just see this profession just opening up and doing so much. And so yeah, it's more than I expected.
Is there anything you would change about your job?
Of course, I give myself more money now. Is this on the recording? Okay. Okay, no. Actually, no. I love it. I love meeting folks. I wish I was there to actually greet and offer tours and take nurses to the unit and meet nurses like Sandra. So I do miss that. But other than that, no. Scratch out the money part.
Sandra, how about you? Is this
You know
career
what?
what you envisioned?
It is, and so much more. As I think Lenora said it so well, I don't think I can even follow behind her, but it's so much more than I anticipated. And is there anything I would change? No, because I believe in everything that you learn along the journey, whether it's, everything is a struggle. Everything is a challenge, right? Like there's nothing in life that comes easy, nothing worthwhile. So I wouldn't change anything for my journey because I've learned so much. I've learned from the good because I've seen things that I'll say, I'll never be that nurse. And I'll see things that I want to be like that nurse. So I wouldn't change anything because I feel like every step along the journey is preparing you for something else ahead. So I wouldn't change anything about my journey. And I'm delighted to be a nurse. It's much, much more than what I'd anticipated.
Thank you both for that. So Lenora, you made a joke about money, but we actually have a question that says, do you expect to see an increase in pay rate for new nurses since the pandemic?
I do, but remember healthcare they're going through a lot of changes. I think in patients, but the recognition outside of the pay is sometimes what you get that really makes your job really rewarding. There's not a dollar sign I can put on a patient that Sandra may have taken care of that have some rare form of cancer that we've been able to take care of them. I think we gave an award to somebody that found the guitar for one of our patients. I can remember even being working in hospital center, responding to cold yellows where, in the 80s where there was lots of violence, and responding to gunshot wounds and going in the operating room and taking care of patients that were severely in trauma patients that had to come to the OR. It's nothing more rewarding than knowing that you've sweated, you've watched them pumping blood and give transfusions and, resuscitate and see that patient out there. So I think that the recognition that nurses got in 2020 it speaks volumes for what people care. And so it's not really as much as a financial, but it's the respect and the dignity. The nurse face has been shown more on TV in 2020 than ever. From CNN to MSN to your local news, everyone has had a story. So to me, that's much more of the reward. Now, in terms of compensation and things like that, I think hospitals are finding a way to compensate nurses. Some hospitals are adding hazard pay. There are some struggles. Our hospital does a great job with rewarding and compensating nurses because we're federal government, but also we have leadership that, as Sandra mentioned, wanted to make sure that we have adequate PPE, which speaks volumes. They make sure even a person like myself, when I go to the hospital, I have an appropriate mask to wear, and I'm not even touching a patient at that particular time. But I think that there is, like I said, the recognition, it goes so much further than the dollar. And I know that we all have bills and things like that to pay. I think you will be compensated fairly, but I do believe that the recognition for nurses this year, it's sad that we had to get this recognition over COVID, but it happened. I mean, it happened.
And Sandra, did you have anything to add?
Well, again, Lenora just ran with it. I mean, it's as she said, it's more than that monetary compensation. It runs so much deeper than that. And as she said, with COVID, unfortunately, one of the things that I've always noticed is sometimes the lack of recognition or respect for nurses. Not from nurses, but from other people that doesn't understand the level of what we do as nurses. You have people that still doesn't understand what you do as nurses because they perceive nurses as maybe just a helper or somebody to change the bedpan, which is so much more based upon what Lenora said. So unfortunately, it took something like COVID for them to recognize the level and depth that what nurses go through every single day. I mean, COVID was just another level up, but we are always at war at the bedside. If you think about nursing in the inner city, I mean, where nurses are threatened or abused every single day. If you think about it, we're like, I've always thought about nursing as being on the battlefield. I mean, at NIH, we have it great because there's certain things where like, you know, certain things. But if you think about the inner city hospitals, where some of those nurses struggle every day with the community in terms of verbal and physical abuse, I mean, it's so much more. So now, unfortunately, because of COVID, people are taking a deeper look at what nurses really go through. And I mean, you see it on TV, the emotions that they bring at the table because they care for these patients. You know, they care for these patients and what they're sacrificing as well. Because with COVID, there were a long period of time where some people weren't able to go home because they were, you know, treating COVID patients and they had family at home. So to protect their family, they weren't able to go home and see their family. So it's a sacrifice and it runs so much deeper. And which is important that when you're going into nursing, you're going into it because you really want to, not from a monetary perspective, because if you do that, you're going to be disappointed. Because I don't think they can ever pay nurses enough. Do you understand what I'm saying? I feel like the level of care that we do, whether you're in mental health, whether you're an oncology nurse, whether you're an educator, I feel like you can never pay nurses enough for the stuff that they do, for the things that we do.
Yeah.
And Shauna, can I add one more thing? Because I also spent a lot of my career in the military. And when I was working in the military, we were definitely in the height of the war, the Iraq war that we were in, Operation Iraqi Freedom, that's what we called it. So we were definitely in the height of that. And the nurses that took care of those the wounded warrior programs that we had back then, with the type of trauma, those blast injuries that we saw coming back from the military, those nurses right there running multiple lines, I mean, handling all kinds of drains and, you know, extensive reconstructive surgery that sometimes took 6 or 7 times coming back in. It's so rewarding. And so that's why I said there's so many opportunities for you to get rewarded. I can't put a dollar amount on it. I mean, and especially now since we're recorded, but okay, that's my joke for everyone, but definitely. And even now, the COVID, if you're really a nurse, there are agencies that are paying top dollar for nurses to work with COVID. I'm going to tell you, it is some money to be made now if you're experienced.
So you brought up a really interesting point about how difficult the work is and how tiring and draining it can be, even if you're passionate about it. So have either of you ever experienced burnout, either in school or in your working profession as a nurse? And if you did, how did you overcome it?
So I think I experienced burnout in school. I mean, for me, it was such a long journey. I felt like nursing school for me personally was one of the hardest things outside of raising my children that I've ever done. Because you're talking about, as an adult learner, going back to school, having to learn chemistry and biology, and to be sitting amongst students that were 18, 19, 20 years old that I couldn't relate to at that point. You know, it was one of the most challenging things, and trying to figure out how am I going to balance having a job, having healthcare, going to school, being successful and graduated from the program. So I felt like I've had some highs and lows during nursing school, looking back. But one thing I can always say that the professors at Howard University, they were always like on the encouraging hand, the reinforcing positive piece of it. Like, you know, like they were like the light in the midst of a dark tunnel then, if I could say that. With nursing, when I just started nursing, I must admit that there were times when I would pull up outside of my house and it would take me maybe 10 minutes before I could get myself together to actually go inside a house. And when I went inside the house, it was like, I was just totally exhausted. You felt like you had no energy, and I didn't recognize it for what it was. But what I learned after is that when you're at the bedside, especially working in oncology, you give so much to these patients. And you're like, you're working on adrenaline. So you're giving, not taking the time to say, oh my God, I'm exhausted, whatever, until you get out of there. And then when you go home, you have nothing to give. So I had to recognize that in order to maintain and to be able to be an effective nurse and a mother and a wife, I had to learn how to balance that. So you try to find a way to block the noise out. So when you're home, which is, you're not always successful, you try to deal with home and not think about work. because you'll be there and you're thinking about that patient. I would tend to pick up the phone and call that nurse. I said, how is so-and-so doing? You know, because you really care about the person. But then you have to learn that, yes, you care, but you have to do that from a distance. Does that make sense? You love them, you love what you do, but you have to do it from a distance. You have to find that balance. So when I was in nursing school and they tell you, my professors would say, you have to find a balance, you have to have a life. That's what they were talking about. You have to find a way to balance when you're home, you deal with home, you don't think about work until you get up in the morning. Are you always successful in doing that? Not really, because you're all human. So you'll be in the shower and that patient pop up in your mind and you're thinking about them. You go to bed, but some way, somehow, you have to find a way to balance it out. And now what I do is like, now I'm so much better at it than what I was before when I just started out as a nurse. Because now I understand the importance of showing yourself some love, right? Because without self-love, you're not going to be an effective educator. You're not going to be an effective human resource specialist or a consultant. You're not going to be an effective infection control specialist. So self-care and resilience is so key to whatever you're doing, to being a nurse. For me, that's my perspective.
I
Thank
think
you.
if I could add also, because
Yes.
I've had some experience outside in the private sector where in some of the major medical centers where there's a major ED. So I have been burnt out in working in a hospital, especially on an inpatient unit, especially as a new nurse, especially when I didn't know how to manage time, when I was still trying to figure out what I was actually doing. And then I had 6, 7, 8 patients there. It can be very, very challenging. I think that the profession itself has done a lot of things like by implementing the residency program. So if you can get a residency program, because it'll kind of help you switch out, and as that Sandra mentioned earlier, but also some of the, make sure that the hospital has some kind of safety and quality measures that are in place to make sure that the assignments are given based on the acuity of patients. So those are things that once you become savvy, you have to look for, because you can get burnt out. I mean, right now, especially as we have what we call from recruiter, talent shortages, where we don't have enough talent. And so we're trying to make do sometimes with the talent that we have. And now, like in our place or in other places, when you take out probably a quarter of your workforce due to COVID, either by being infected or having high risk group and can't being able to work, you're really, really strapped. So it will be stressful, especially depending on where you work. I personally, from my first job, I experienced the worst burnout, and I thought I was not going to make it to be here even on this call now, but I had to kind of figure that out, and I had to do a lot of navigating.
Lenora, do you remember, can you share some ways that you were able to overcome that burnout?
So I did, my coping mechanisms my examples probably aren't as good as Sandra's. But I can tell you one of the things that I did. I always loved some form of exercise. So that was always something that I was able to do. But I'm a friendly kind of person. So I always like to either have a book reading club, a support group, girls' night out, whatever. I always found those kind of ways. But in the unit, what I was able to do from a professional standpoint, I learned to make friends with some of the most senior nurses that worked on my unit. And I kind of used them like a Sandra. So I had to learn a lot. And that's what you really need to do. You have to find a mentor. If it wasn't for my mentors or my Sandras on my unit, I would not have made it. And they took me kind of under my wing. They showed me shortcuts. They helped to help me kind of deal with some difficult physicians. Being able to communicate effectively when a difficult physician looks at you and gives you the business while you're there trying to take care of the patient. Those kind of coping mechanisms that you will get, that will help. And once you get those, it kind of, you're able to cope, because then you're able to put work there. And then kind of, if you do have those other nice things that Sandra has, like the meditation and all those things, and you do those also. I shop too much. That's my probably getaway. That's why I probably need more money, but that's to keep it real.
Well, thank you for
Did
that.
I get
Thank
it?
you
Did
for
I answer,
sharing.
Sandra?
Yes, yes, you did. Thank you for sharing that. So we have a question in the Q&A that says, besides traditional bedside nursing, how would a person move towards other nursing options? What would be a pathway? What would a pathway potentially look like?
So I think now, and I think this is something that I work with a lot of groups. There's really no such thing as traditional bedside nursing anymore.
Hmm.
And the reason why I say that, because patients now are becoming more and more complex. We're learning more. So just about every unit here has a specialty. For example, we have our medical surgical unit, each one of them are specialized. So in our general medicine unit, they do a lot of endocrine studies, and they work with a lot of patients with Cushing's disease. If you're in nursing school and you're learning about that, pituitary disorders. In Sandra's area that she's now in, the medical surgical, where they do telemetry, but they have those infectious diseases. So I don't think that there's not a such thing as traditional bedside nursing, but to kind of go with the pathway of being a kind of a registered nurse working as a staff nurse in the hospital or of the nursing home, being a direct care provider, you can branch out. There are professional organizations. Say, for example, you want to become a GI nurse. There's the Association of Gastroenterology. So you could probably join those, learn how to take tests, study the craft, and then learn how to navigate those ways. Also, your hospital may have fellowships. I mean, we're looking at fellowships now that will take a nurse from, saying, a bedside experienced med-surg nurse to have a specialty training in operating room. That's how I became an operating room nurse. I took a fellowship. I became a NICU nurse because I took a fellowship for the NICU, or I did those kind of things. So I think there are opportunities there. We, as recruiters and hospital leadership, recognize there's a need to move certain people to specialty, especially as we become more sophisticated. Sandra took oncology courses, so she's oncology, chemo certified, so she can give chemo and all those things like that. I don't have that, so I had another specialty. So there are avenues for you to get that. But don't look at it as the one bad med, because nothing is like that anymore. I think everything is complex.
Thank you. Sandra, did you have anything to add, or we can move on to the next question?
You can move on to the next question.
Okay. Our next question says, I hold a master's in public health. What would be an entry-level position I could look at NIH while I'm in nursing school?
So for our department, not many in our nursing department. Now, whether they have other positions that are within some of the institutes, like either some places have what they call health system specialists, some places have patient care coordinators. Those roles may be available where you, or a program specialist or a program analyst when you work for maybe the National Institute of Allergy and Infectious Diseases in that way. But for example, in our area now, even our PCTs are working with Sandra's, becoming lobby screeners. They're learning a lot about helping in the public health with the COVID. So our persons that say have a certification, a patient care certificate is also helping kind of in that whole infectious disease process, helping out with what we call our screeners now, our, kind of helping the NIH persons that come and visit become safe, working with occupational health to make sure that we're doing all the tracing and tracking so that we can have a healthy workforce. So there are some opportunities that are available that may tie you to the nursing department or to the actual infectious disease public health type things. Sandra, do you have anything?
Yes, if I might add, don't forget that I think a year into nursing school, when you're clinical, you can actually get a patient care tech license. So don't forget, I think that's an excellent route to integrate into nursing, because you're getting the hands-on. There you can tap into the resources like Lenora spoke about, mentors, on the unit. You can learn different things from nurses, from the team, from being in that environment, which will make nursing an easier transition for you. So don't forget about the PCT role as well.
Yeah, I think some of the board, like the Maryland Board of Nursing, they'll take your transcript and kind of look at what your courses are, and then you can apply for the CNA certification, and the CNA certification can have you apply to other jobs. And the way that your master's in public health right now is valuable for what we're dealing with right now. It could be applicable.
Yes, thank you both so much for that. Along those same lines, when do you start hiring new grad nurses for the residency program?
So we will start having, and I'll definitely share some information. We'll start having information sessions. Actually, we'll have information sessions beginning December. Our program is held annually. Our application process starts annually in May, and we kind of come up with the dates that the vacancy is announced. And then the program starts in usually September or October. But we make the selections like the end of June, July, and that's when we make our final selections after the interview process. So we're gonna host some information sessions. I'll make sure that you guys have information to disseminate about the information sessions that we'll hold, and it'll kind of give you the background of our residency program and what's required.
Great. Thank you. That would be fantastic. Do you think that some of the COVID-related changes that have happened will stick around long term?
You take it, Sandra.
I'm not sure how to answer that question. I don't think, I think that's like a big question for many people, even for people like Dr. Fauci. I mean, when you said long term, what are you talking about? Symptoms? Or are we talking about, what exactly are we talking about? I feel like there's so many things that we really don't know at this point. So it's hard for me, to be honest, to answer that question. I mean, in terms of changes. So it all depends on what you're talking about.
I think there will be some changes. It's just like HIV. When I became a new nurse, HIV was new. So I was in nursing school and we couldn't wear gloves when we did our clinical practice to wash patients and give injections. We didn't wear gloves. And then as soon as I graduated, it was like, okay, this new disease requires you to wear gloves now. And so I think there will be some kind of maybe practices that will come out that may help us that along the way. But now we don't, it kind of all looks the same. We treat the HIV patient and every patient almost the same now because we've kind of mastered those practices and we just incorporated them. Not that it stands out. We're going to be like everyone is for COVID. I think that there'll be some screening or some kind of practice or something that we have, whether it's on the immunization record, whether it's on your occupational health screening that may be incorporated in there. But that's kind of my think on it long term.
Yeah, that sounds reasonable, that there will be some practices that remain after COVID is hopefully eliminated, or at least we have a vaccine. What do you believe will be the best way to solve the worldwide nursing shortage?
Well, that's a dissertation. For sure. It is. But we have experts that are looking at our numbers and looking at really analytics and data. They're also, you heard a lot about aging, our life expectancy and patients living longer and us living longer and having more diseases that more diseases and things like that we're living longer and diseases and we're able to sustain life. I mean, the life expectancy is, I can give you HIV was very short at that time because the patient developed AIDS and typically died. Now we see that has changed and HIV positive patients are, living longer, more fulfilling lives. So I think that just in terms of the nursing shortage, more schools, of course, more educators, because we struggle with faculty for nursing. And then I think also probably there's a lot of work that the nursing community they're doing, making whether it's going to be a standard BSN, what's going to be the requirement. So there's just a lot of background work going on, but there are experts that's looking at it. But it's a dissertation from what I see.
Yeah, it sounds like it'll have to be a multi-pronged approach to tackle that issue.
Definitely, yeah. Definitely. And, like now some of us may have thought we had some of our vacancies kind of in line, and then we got hit with COVID. So,
Right.
oh, nope, not so sure. And, I was looking pretty good before COVID happened, but, then COVID happened and my recruitment had to change and elevate and, build new programs and things like that.
Yeah. So Rebecca would like to know if the NIH hospital does labor and delivery.
Nope. Nope. Not for the perspective here. We don't, that's the one thing we don't have. We don't have an ED. So we don't, we don't have an emergency department. We don't do obstetrics. But we, they're work closely with the people across the street too that have an emergency department as well. So
Right.
that's the National Military Medical Center.
Do you provide scholarships for nurses seeking their bachelor's degree while working with you?
We have a tuition assistance program that a nurse can apply, and definitely it's for everyone that's in the nursing department, but we do kind of prioritize to make sure that we try to fund nurses that are going to say an associate degree nurse that is here and they want to get their bachelor's. They definitely are on the priority list to receive some of the tuition assistance funds that we have available, but it's kind of across the board for everyone. And you have to meet certain criteria, have to be in good standing, things like that. And then you can apply to the program.
Thank you. So we are running close to time. We have about 4 minutes left. And I'd like to ask, where do you see yourself in the next 5 to 10 years in this nursing career? For each of you.
In the next, let me see. Honestly, I see myself teaching at a university. Mm-hmm. I do. I mean, in addition to nursing, I can't see myself stepping away from nursing at the bedside, like in a healthcare facility, but I see myself teaching, whether it's community college students or, bachelor degree students. I just see myself in that role maybe in the next 10 years.
Mm. Nice. That's fantastic.
Well, so I've been a nurse over 30 years. I graduated in 1988, but I do think that I have more to give. And so I see myself kind of sticking around, building more programs like this program to help outreach programs that will help draw nurses to the NIH Clinical Center, but also to the profession. So I also work with the Maryland Healthcare Recruiters Association. I am in charge of student outreach there. So this is my passion. And so hopefully I'll be around for maybe a little bit more than 5 years, also working with the NIH to build our nursing program. And then, but also with my Maryland Healthcare Recruiters Association, doing more student outreach activities. So I hope that's where I am.
Wow.
Yeah, unless I win the lottery.
That sounds fantastic for both of you. So with our last 2 minutes, I just want to know if you have any advice for future nurses who are on the Zoom call, looking to make careers hopefully as great as yours are right now.
So I was kind of browsing through the your Q&A session, and people were asking, like, for example, how did I did school with kids and so forth. So as back to what Lenora said earlier, just be resilient. If nursing is truly what you want, and if you really feel that that's what you're called to do, don't give up, regardless of what the challenges are in life. Just stick to it. Make a goal, make a plan, whether you have children, you have family. Try to carve out that time to focus on school so you can get to where you want to go. But don't ever give up on your dreams. Hold on to your dreams. And I feel like you will. I know, I'm not going to say I feel, I know that you will see the light at the end of the tunnel if you just stick to your dreams.
And I like to also echo a little bit of what Sandra said. First of all, I joke a lot on this call because I know that it's hard. It's hard in nursing school, and it's hard to even not want to stop and give up there. I just want to let you guys know, really and really, if you want to do it, there are so many resources for you now to make this, your dream, become a reality. First of all, we have a job market out there that pretty much will, what are looking for persons like yourself. The second thing is that this profession, as I mentioned to you, can go so many different ways in your life. I mean, there are so many aspects of this profession. You are not in a box. You're not in a hospital. You can be at a community clinic. You can go to a long-term care facility. We have prison nurses. We have military nursing. There is so much for you to do. So don't give up. Stay resilient. Have a little bit of fun. This is your fun day off, because if your professor told you to come here, this is what I wanted this to be. And I wanted to speak with you just from my heart, being very authentic, that it's not always easy. I mean, it's not even easy in this job. I got to deal with a whole set of problems when I get off this call. So actually, this was a little bit of a break for me also to be here. But I think that just staying true, study. If you need study guides, if you need resources, I tell people partner with your other nursing student and then exchange notes. If you can help each other out with childcare or chores or car rides or rides to clinical, make it work. You just got, this is your time to be creative to make this profession work for you. And you can do it. I did it. You can do it.
Thank you both so much. I think that's great advice, to be persistent, to be resilient, to take care of yourself and be well, and to be creative in solving those problems that are eventually going to come your way. I really appreciated talking with you today. I've learned so much, so thank you. And on behalf of everyone here, we appreciate you and thank you so much.
Thank you so much for having us, guys. Looking forward to see you next year, and good luck to everyone. You can do this. You got this.
You got it. And I'm going to send the information about our information sessions also. So I'll make sure that's available for you guys. And thank you. Have a great day.
Thank you both. Have a great day. Bye-bye.